I'm Gail Davey. I'm Professor of Global Health Epidemiology at Brighton and Sussex Medical School, and I'm Director of the Centre for Equitable Global Health Research. The Centre for Equitable Global Health Research is a growing network of about 200 interdisciplinary researchers based at around 20 or 25 partner institutions around the world. These institutions are in countries that receive overseas development aid funding, and that's a basis on which the centre operates. The common thread to the research that we do is that we study the most neglected conditions in these countries. We use a sustainable and people-centred approach to do equitable, impactful research. The partners that we work with are encouraged to contribute at every stage of research, from thinking of the original research idea to checking it out with patient communities, to developing a proposal, and then to executing the research and developing articles and impact studies and policy briefs from that research.
My name is Semrau. I'm a Principal Research Fellow in Implementation Research at the Brighton and Sussex Medical School, and I'm the Deputy Director for the Centre for Equitable Global Health Research. So what is our vision for the future of the Centre? Well, our aspiration is to improve global health by building a globally recognised, sustainable and people-centred research network that models equitable partnerships and conducts impactful, ethical and sustainable research on neglected health conditions in ODA countries. We have 5 core values that we've structured around that aspiration, and they are equity, co-creation, ethics and honesty, interdisciplinarity and multisectorality, and impact. Equity is something that we've been thinking a lot about recently and that we'd really like to carry forward as a key focus within our centre. Some of the things that we've done recently to facilitate that is to appoint a non-executive director from the Global South, Professor Getnet Tadella from Ethiopia, within the centre. Another thing that we've done is to embed equity within our name. So we have recently renamed ourselves as the Centre for Equitable Global Health Research to reflect that key focus that we have. One thing that we're thinking about a lot at the moment is how to actively involve even more persons and communities who are directly affected by the research that we do within everything that we do within the centre, and we're actually developing a grant application around that at the moment. Going forward, we're also going to be embedding a partnership group within the centre of a range of different stakeholders to make sure that we have Global South representation and that we have the views of a range of different stakeholders, including affected persons and communities.
One of the benefits of co-creating research with end users like patient communities and ministries of health is that the research that we do tends to have impact relatively quickly. Here are some examples at global, multinational and national level. So research from the centre has contributed to the WHO recommendations on first and second line antiretroviral therapy, and also to the UNAIDS policy report on universal test and connect. Again, at global level, about 95% of the evidence used to develop a WHO Academy course on podoconiosis management originated from the centre. Across multiple countries, we've had policy briefs on a range of neglected tropical diseases, including cutaneous leishmaniasis, scabies and podoconiosis. And countries in which these have emerged include Guatemala, Ethiopia and Rwanda. And then for the UK government, evidence from the centre was used in the first report on modern slavery in 2020. This was evidence linking forced labour to the production of medical goods and was very important to that first statement. So across all these levels, we do our best to make sure that the right stakeholders get hold of the evidence in ways that they can interpret and use as quickly as possible for the benefit of patients and their communities.
How can you get in touch and how can you get more involved? Well, we recently launched a new website, which you can access on the BSMS websites, and you can also access our newly launched strategy document on that website as well.